Good morning. We are coming to you live from our Health and Wellness Fair, the City of Lansing's Human Relations and Community Services. We have over 63 vendors here, and so this is their first stop. This is our volunteer, Gloria. She has been helping the participating vendors, and this is the legendary Willard Walker, and he's also been helping the vendors. And as you all know, this is our wonderful mayor, Mayor Andy Shore.
This is the best team in the world. We have incredible staff here. They're working so hard for a long time to make sure that our community has all the resources they need to be healthy. So thank you, Delveda and Willard and the whole team.
I'm standing here with Chief Sturdivant. You want to have a couple words?
Hello, Lansing. Hope everyone is well. Come on out and join us. We got a great event going on here on the lawn of the Capitol. The weather is perfect. Come on out and spend a few minutes with us. I think you'd be pleased.
Thank you, Chief Sturdivant, and thank you for being here. We have the fire rig here. The kids can go over and see what's going on over there. On this journey to health and wellness, we have our wonderful Lansing Fire Department here. Yay! Thank you guys for being here.
Howdy. We are here downtown. We got our Engine 41. We're at the Touch a Truck event, so you're welcome to stop by and see what the fire truck's all about. And then we've got some stickers and some hats to give away. But yeah, come down. It's kind of fun to get out and see everyone on a different set of circumstances. So anyone's welcome to stop by.
We are now standing at the registration table. We see all of our staff and volunteers working over here. Fill out a brief registration form. It's real easy, real simple. We just want to know how many adults are in your party, how many children are in your party, and the age group. Once you complete this registration form, we will give you a bag. We will give you a bag for registering, and it has swag in it. It contains a stress ball, it contains a hygiene kit, and a folder with information in it. This table also has information on it about the Human Relations and Community Services Department. We also have a passport. This is the passport that you will need when you go and visit the vendors, and it simply says, Passport, embark on your journey to health and wellness. And so you get your passport, you visit the booths, and have your passport stamped. Once your passport is, the vendors will stamp your passport. Once it's filled up, you can bring it back to the registration table, and the nice volunteers over here, will give you a food ticket. You can visit any one of our food booths that are out here. We have several booths out here. We also have sultans. Sultans will be in the big tent over there. So all of the food is free. We also, at this table, we also have a drawing. If you complete this feedback form, because we want to know how we did. We want to know how we're doing. We want to know how the community received the Health and Wellness Fair. And so you can fill out the feedback form. Once you fill out the feedback form, you will be entered into a drawing. We have several gifts that we're going to be giving out throughout the day. Our grand prize is a gift that was donated by Tom Izzo. It's a 4-pack. It's a family pack to a football game. And you and your family will be able to get into the game free. And you will also be able to go out on the field. And so we're very excited about that. So again, come on down. Good morning. Good morning, City of Lansing. How is everybody doing? On behalf of Director Kim Coleman and the Human Relations and Community Services staff, thank you for choosing to be a part of our event today. Thank you to the community and to all of our participating agencies. Thank you to each person represented on this platform today. Today, we have our very own Mayor Andy Shore. We have members of the HRCS Advisory Board, Frank Lee, Dr. Thomas Woods, and Sean Yaley. We also have the Ingham County Health Center's Chief Medical Health Officer, Dr. Nikkei. We also have Julia Miller from Punks with Lunch. We have many, many great things planned. But before we get started, let's hear from our mayor, Mayor Andy Shore.
Well, I want to thank everyone for being here. We're already starting to see some folks show up, but thank you to all the vendors, everyone out here. This is the City of Lansing's first community health and wellness fair. I have been hearing about it everywhere. Every time I get in the car, I hear it on the radio. I saw billboards. Kim Coleman has been talking about it every day for weeks, months. Our HRCS advisory board, our citizen advisory board, has done such a great job of kicking in and helping out. These folks don't get paid. I can double your salary because you don't get paid. But they do such a great job on behalf of all of our citizens. And again, it's appreciated. This event was put together to bring further awareness to a variety of health issues, including opioid and self-harm challenges that people in our community and honestly in every community face. So while it's in every community, we here in Lansing want to provide the resources to help. Everyone has been invited to share health information and services, so all the vendors we have, as well as their unique resources and their experiences to aid in fighting the opioid epidemic that our country is facing. Our human relations and community service, you'll hear HRCS, human relations and community service staff have been working so hard. You heard from Delveda, but you'll see a lot of the staff with the shirts on and the Lansing logo. They're here to help, but they have been doing so much work to put this together for our citizens and our residents in our community because they want to proactively be part of the solution and not just complain about the problem, but be part of that solution. So I want to thank all the organizations out here, all the vendors and providers. We couldn't do it without all your participation. I ran into Sean Gailey and he said, what an impressive showing of all of our providers. Whenever we do resource fairs and things like that, the providers always show up. And here we are at the Capitol. We are the capital city. We know that. We're proud of it. And here we are at the Capitol with our Lansing and Ingham County vendors showing up and coming together to support our citizens, many of whom we know face a variety of health and other challenges. So I want to thank you all again. We have a great day planned with food and games and information, and I understand there's even some dancing, although you will not find me dancing. That's an ugly sight. But please go out and enjoy all the vendors. And as you're walking around, please call and text a friend and let them know, especially if there's someone you know in need. Let them know we're here until 2 p.m. Come on down to the state capitol, get the information and the help they need. So thank you all for being here. Now I believe Julia Miller from Punks with Lunch. I'm going to introduce her to say a few words. Thanks, everyone.
Hi, I'm Julia Miller. I'm the Executive Director of Punks with Lunch Lansing, and I'm also the founder. We are a harm reduction organization, and we started here almost 7 years ago. And 7 years ago, it was a different scene, and for one, I never expected that Mayor Andy Shore would be my opening act. I myself am a person in long-term recovery from opioid addiction, and Punks with Lunch was started primarily because, honestly, I was sick of seeing the people I love dying from overdose and infections. I was tired of the stigma and the lack of health care or support that people who use substances are subject to face by others in society. I myself found my way out of chaotic relationships with opioids, and I was fortunate enough to have my family as a support network, seeing me through withdrawals, relapses, and recovery. All the while making sure that I had access to food, shelter, mental health care, making sure that I knew I was loved. No matter what I was going through, I was loved. No, not everyone has that. And I knew that I had love to give. So Punks with Lunch was started on that principle, that harm reduction is love. At first, very small and underground, as some of the services we provide were not widely accepted, and as time has changed, we've been more able to grow, offer more support services to a wider range of people. We now have an office located inside the Fledge Community Center where people who use substances can access a wide array of resources and supplies. We operate a needle exchange, we provide food resources, we provide hygiene supplies and information about recovery. And we also have our mobile unit, which is parked over here today. You're welcome to come check it out and see what we have on display and as far as what we typically distribute and ask any questions that you might have. A lot of times there's stigma and negativity because, well, we pass out safer use supplies, operate a needle exchange, and sometimes people say that it's giving people a permission slip to use substances. But they don't really understand that because people who will only change their behaviors when and if they're ready to, and that even if they're not ready, we still want them to be safe, to be hygienic, to not be subject to abscesses, infections, disease, or overdose. The safer they are, the better chances of survival they have. But harm reduction isn't just about new needles and Narcan. Harm reduction is about being a listening ear. It's about connecting the dots to other services. It's about saying, hey, have you eaten yet today? Do you want a sandwich? Henceforth, part of our name. It's about providing warm clothing when it's cold or sunblock when it's hot. It's about helping that person that decides that they are ready to go to treatment through the intake process and helping them get there. And it's about not shaming or chastising that person that says that treatment or abstinence isn't what they're interested in striving for today. It's saying, that's okay, I love you anyway. And finding out what resources or support might be available to help get them to where they do want to be. All in all, at its core, harm reduction is love. And I know that harm reduction works, and it's helping to keep those that I love and those that you love alive today. Thank you so much for allowing us to be here. I'm very impressed by the turnout, and I'm so proud that we were able to be here and represent our org and represent Lansing. Thank you. And I will introduce Dr. McKay too. Thank you.
Okay, now that was a tough act to follow. Thank you, Julia, for all you do. Good morning, everybody. Yeah, it is still morning. Good morning. I'm Nikesh Rinka. I'm the health officer at the Ingham County Health Department, and it's a great privilege to be here to be part of this great event today. First of all, I want to say thank you to Mayor Shore, to Director Kim Coleman, Delvita, the rest of the team for prioritizing the health and wellness of the City of Lansing residents and Ingham County as by extension, but not only prioritizing that health and wellness, but also elevating this issue, this critical issue that is a threat, right, to our health and our wellness. It's one of the most pressing threats to health and wellness in this day. It's tragic, and that's the opioid crisis that we're talking about today. This has impacted multiple lives. Just as Julia said, we are talking about millions of people who are suffering with substance use disorder every day. We're talking about thousands of lives that have been lost as a result of overdose, and then the overall impact that this has on our communities is like a ripple effect. So we talk about the people who are impacted, and then we talk about their families, what that means in terms of our community, our healthcare system, and society, as a whole. And so thank you very much for highlighting this today. It's really important that we have this conversation. The opioid epidemic in general began with a well-intentioned effort, quite frankly, to manage pain more effectively. Prescription opioids like oxycodone, hydrocodone were introduced as a solution to pain management, to improving the quality of life for many people who are experiencing chronic pain. But then this had this unintended consequence that increased the risk of increased substance use disorder, increased overdose deaths, and now we have this crisis on our hands that we're all grappling with and struggling to catch up on and overcome. Not only does this opioid crisis come from the prescription medicine that I mentioned, but opioids are also abused as a result of use of substances that are not necessarily prescribed, like heroin and fentanyl. And then you can also think about, as we talk about the opioid epidemic, though, we can talk about so many other substances that are abused as part of a substance use disorder. And as a result, lead to addiction disorders that lead to all the things that we've talked about this morning. The statistics are sobering. I will not bother you with exact numbers, but just to say that they are way too many. The impact is, like I mentioned, overdose deaths that we see in the last year, even here in Ingham County overall. we saw almost 100 deaths as a result of that were related to opioids. We see hundreds and hundreds of numbers of people who visit the ER as a result of non-fatal overdoses. When we think about those opioid use disorders, like I said, a lot of people start as a result of prescription use, and then subsequently it leads to a lot of other unintended consequences: chronic disease, infectious diseases, hepatitis, HIV/AIDS, and mental health. That is another really big one. Like I mentioned, HIV and hepatitis, the increased use of needles to use those substances results in infections that have long-term consequences. When we think about what that means economically, everything related to our opioid crisis has driven up the cost of healthcare to us as a society, but also to individuals. Remember, I mentioned the increasing number of ER visits as a result of non-fatal overdoses, and all those consequences that I mentioned, the chronic disease, the infections, all of them impact us as individuals, people who may or may not have insurance, who may or may not have enough to cover it. Even if they do, maybe they are uninsured, underinsured, and even when they do, it still impacts them in the context of productivity loss, in the context of having to work and not being able to. It impacts our families. When we think about the individual who has and who's struggling from a substance use disorder, Julia mentioned the fact that she had a lot of support. Family support, someone who was consistently telling her that regardless of where she was loved and she would continually be supported. I need to give kudos to her family, because not everybody has that and not everybody can do it. That creates a significant toll on families who have their own things to do, their own lives, their own jobs, their own activities, their own health to take care of. And that creates a really, really big strain on individuals as family. It disrupts the family in general. It disrupts our community as a result of all of that stress that it adds to the situation. So when we think about this, think about the stigma. When you think about or know someone who does have a substance use disorder, and remember, I want you to note that I am not using the word addiction. I'm not saying someone who's using drugs, but I'm saying someone who has a disorder. The stigma related to substance use disorder causes a lot of isolation, and it prevents people from seeking the care that they need. So when you see people around you who are suffering from this disorder, giving a helping hand and seeing it from a different perspective is critical to their journey in seeking help and getting better. When we think about all the other things that this causes to us as a community, it's imperative that what we're doing here has to happen and happen continuously. Prevention is key. What we have here, providing these resources in different formats, from direct health care to resources for harm reduction, educating ourselves on what's available, education in the schools, in our communities, so that everybody knows what is available, is crucial to us addressing this epidemic. Treatment and what is available is critical. Treatment comes in many forms, and like I said, Julia mentioned harm reduction. One of them is medication-assisted treatment, which helps individuals to reduce the cravings and desire for medication and reduces the effect of withdrawal, which is one of the things that causes people to go back again and again to the substances that they are using. So many primary care providers within our communities provide medication-assisted treatment. So please, if you know anybody who does need this support, encouraging them to have a conversation with their primary care provider is critical. Now noted, there's so much that still needs to be done. Even though these resources are available, we acknowledge that we have so much yet to be available in terms of rehabilitation, in terms of recovery, in terms of treatment, even medication-assisted treatment, as I mentioned. And those efforts are continuing to happen at multiple levels: federal, state, local, city, like I mentioned. Even this effort today is a big piece in the puzzle that we need to put together. So today, the last thing that I want to leave you with, while acknowledging that addressing this is critical and it requires a united front from everyone, government, healthcare professionals, community, family, all the community partners that are here today, and even more. Your efforts are appreciated, they are welcome, and whatever else is needed that you decide or you recognize is needed, please continue to speak up, please continue to speak to this issue so that we can truly, all as a community, live a healthy life. I just want to touch on one thing quickly. It's wellness. Everyone, each and every one of us deserves a happy and fulfilling life. And when you think about wellness, wellness is that space where all things, all the aspects of your life find a balance where you're happy and you feel fulfilled. And that includes health, right? If you're not healthy, that impacts your wellness. So today I encourage each and every one of you, as you do the critical work that you're doing, providing services in the community in every form, to find the balance that you need to ensure your own wellness too. Whatever that needs, creating a lifestyle that supports that is critical, so that you, as you serve in this community, the great work that you do, you can continue to do it from a place of wellness, from a place of health. So again, thank you to everyone who is here today, providing for all the work you do in the community, providing the services that are critically needed. We need more of you. You are greatly appreciated, and please, please be well. Thank you very much.
Thank you, Dr. Nikki, and thank you to everyone who was on the program. Thank you all for being here. I just hope you guys are ready for a great day of fun. And yes, we do have something for everyone. Be sure to get your passports from the registration table. Make sure you get your passport stamped and filled out so that you can receive a free lunch. We have food trucks here. We're gonna have sultans under the tent, but you must have your passport completed in order to get your free ticket to get your free meal. And so that's all a part of the fair. Everything at the fair is free. Before I let you go, I just want to tell you about some of the things that we have today. We have tent talks over to my left. They'll be talking about things from mental health. The K9s for Change, they will have a presentation. So look in your bags, your registration bags, and make sure you see the program so that you don't miss out on anything. Look at your schedules. We're gonna have exercises. We're gonna have line dancing. I'm gonna be watching you guys to see your moves. Let's see what else we're gonna have. We're gonna have drawings. We're gonna have several drawings throughout the day where you can win prizes. Hello, hi. I am so excited, can't you tell? And so I'm excited to be here, and I just keep on saying, if we could just help the community, that's what Human Relations and Community Services is for. We are here to help our community, and we do want everybody to be well. And so again, on behalf of our Mayor Shore, on behalf of the HRCS Director, Kim Coleman, and on behalf of the great staff of Human Relations and Community Services, let's just give it up for the staff of HRCS. Yes, we worked very hard to bring this to you all. And so I'm excited. I hope you're excited. Go and enjoy.
So with the Key, we provide home care services for the elderly, and also with a specialty in dementia and Alzheimer's. If you know anyone that is interested in needing a caregiver job, or if you yourself are interested in having interest in the caregiving industry, go ahead and sign up for us at www.thekey.com, or feel free to apply directly online with our application.
My name is Jack Blaylock, and I used to be homeless in Lansing. I used to live underneath the Kalamazoo Street Bridge over here with me and my cat right here. And but thanks to the help of Punks with Lunch, they helped me get the voucher and everything. And before I know it, I'm now living in an I have an apartment now and everything, and I'm not on the streets no more. Stop off at the booths and go over and see my old friends over here and stuff and everything, and see how they've been doing. I don't know too much about the wellness event. I seen it on Facebook and decided to come down and check it out and see what's going on.
Hello again. Now we are over at the table where we are giving out free fruits and vegetables. Yay! We are giving out free fruits and vegetables, and we're inviting everyone to come over. And so I'm going to turn it over to Dan and Josh.
Come on out. Thank you City of Lansing, HRCS, for sponsoring this. We have strawberries, we have watermelons, we have bananas, we have kale, onions, apples, onions, sweet potatoes, white potatoes. It's here, fresh fruits and vegetables, because we're trying to be well.
And we have Josh.
Yes, and so thank you guys. Thank you to the community. You guys come on out and be well.
Child and Family Charities, we love that we're out here spreading the word about our 30 different programs that we have for children and families in the Lansing and Tri-County area. So you can find information about all of our programs at childandfamily.org, or you can find us on Facebook under Child and Family Charities.
This is the adult one, and this is the kid one over there if you need one. Okay, sorry. Hi there, my name is Carly Walter, and I'm the program manager for the Veteran Housing Program with Holy Cross Services New Hope Community Center. We have a homeless shelter about a mile from here, and we have overnight shelter for men, women, veterans, and families. We also have a day center for folks that need to get out of the elements, need access to our community kitchen for free meals, need to use the washer. What am I missing? A computer, a phone, access to case management, and all sorts of good resources. We're located on 430 North Larch Street, so stop on by.
My name is Miranda Houston. I'm a certified clinical trauma specialist and a life coach, and we help people recover from trauma holistically. And so we offer at the very beginner basic services such as sound healing, as well as in our wellness center, natural bath and body care items, as well as adaptogens to help our bodies acclimate to stress. So it's a non-invasive way to really shift energy, right? And then you can take a flyer as well. So, because I'm just brain frying right now. And we're located 3911 West Michigan Ave, and you can also contact us holismhouse.com, or our phone number 517-481-4287.
NAMI Lansing is one of 600 affiliates of the National Alliance on Mental Illness. We serve people that live with a mental health condition and the people that support them. We do that through support groups, education classes, and a number of other advocacy groups.
Question 2. As long as one member of the family knows what the emergency plan is, the entire family is prepared. No.
You are correct.
Yeah.
Thank you.
I got
a flashlight or a first aid kit.
Yes, a first aid kit. Yeah, thank you. I won.
Please note, I change, initiating communities, helping area neighborhoods gain empowerment. And what we do, we provide behavioral health services, regardless of their ability to pay or their insurance. We do not turn anyone away, and we meet their needs. And if you look on our informational handout, you'll be able to see that in fact, we're one of the recipients of the Ingham County community grants. So iChange will be there giving out these resources, and what they do, they help meet the basic needs of anyone in Ingham County, Thank you for the opportunity to promote iChange.
Women's Center of Greater Lansing.
Hi, so we are at the Community Health and Wellness Fair, and I'm here for the Women's Center of Greater Lansing. We offer free services anywhere from therapy and counseling to resume and cover letter building. We also have a professional clothing boutique where we give free clothing twice a month to women, and also offer free hygiene and wellness products. To find more information on us, you can follow us on our website at lansingwomen.org.
It takes about a year. We give the puppies to folks, try to match them to the person's needs. We have labs and golden doodles. Our golden doodles are pretty close to hypoallergenic. They don't shed like the labs. So if you have allergy problems, they're more helpful than the labs. But everybody has a different personality, and every dog has a different personality. So we try to match dogs and people with their needs, active lifestyles or non-active lifestyles, whatever someone needs. So the process is that you come to us, we do an interview, we have you meet with our dogs, we match a dog with you. Our dogs all have puppy raisers, so we have a group of folks that puppy raise for us. We're always looking for volunteer puppy raisers. I'm looking at you. Yes, you could. We stay connected with all of our dogs. And because we're getting bigger and bigger, we have a big need for volunteers, and we would love to train people to train dogs. You come for an hour of training once a week for the time that you have the dog. So if you have the dog for 8 months, that's really the only expectation. And then of course that you take care of the dog, love the dog, feed the dog, take care of it like it was your own. And then when it's time for them to graduate and move on to training, we keep you, I see your face getting a little sad. We keep you in touch with the person that the dog is going to, if we can, and then you get to watch them graduate and become a canine hero and help people. It's really a moving process.
Give yourself a hand as everybody comes. Thank you all for being here this afternoon. What an amazing day. Today we gather to remember and honor the lives that were cut short by opioid addiction, a crisis that has claimed too many precious souls. Each person we remember today was more than just a statistic. They were beloved family members, cherished friends, and valued members of our communities. In their memory, let us pledge to 1, raise awareness, 2, support treatment and recovery, 3, celebrate their lives. May their memories be a source of inspiration for change and compassion. As we hold their loved ones in our hearts, let us move forward with renewed commitment to making a difference in the fight against opioid addiction. To those we have lost, we say, you will never be forgotten. Your lives mattered, and your legacy will continue to inspire hope and change. Rest in peace.
Can you raise your streamers up? Thank you. Yes. For so long, for this night of pain, that a star would guide you my way to share with me this special day when ribbons in the sky for our love. If alone, may I touch your hand, and if pleased, may I once again This is not a coincidence, and for more than a lucky chance, and with it was always meant. There's a rhythm in the sky for our love. Oh, we can lose with God on our side, and when tears we cry, and for more. Rhythm in the sky, oh, a rhythm in the sky, a rhythm in the sky for our love. A rhythm in the sky for our love. Thank you.
Thank you all for coming out, and everybody have a wonderful day.
They walk it on the east, they walk it on the west. The south side just got it, north side snapping it. In the club on the booth, big stacks, no flex. These suckers wanna try me, tell them too long dead. He walking in his warrants and he's smoking on the loose. She walking with a friend out in the snow.